B. I need your advice on something, since you're probably the ones most qualified to give it. I'm a nurse orderly at a nursing home. Been there for a year so far. I work the night shift on the West Wing. It's not that tough, since most of the residents are so old and medicated that they sleep the night away, only rarely dying or stroking out, or getting up to eat their own poop or something. I usually wind up playing my DS or reading at the nurse's station for the full 4 hours I'm on watch alone, from 1 to 5. However, a new patient arrived a month ago, which got my attention. A 7-year-old girl that was in a car crash that killed her parents and took her legs, right arm, and right eye. As a ward of the state, and so messed up by all the trauma mentally that no foster parents would touch her, she got sent here when she got out of the hospital. God, she's so cute. She's half Japanese, but has blonde hair, and the rest of her body that didn't get cut away is just perfect. She used to be a gymnast, it seems. I've had to answer her call button several times so far, when she's had to use the restroom in the middle of the night, which meant carrying her from her bed to the toilet, then holding her as she used it, and she always looks away from me when she did so, blushing a little bit. The next paragraph is a reference to a sick running joke on B, popular in 2006, that whenever a B-tard sees a little girl, they probably might rape her. The reason NurseCun posted this is because he mistakenly believed he had to fit in with the legendary fucked up attitude on B to even get a response. In later threads, NurseCun proves that the post below did not reflect his actual beliefs or intentions at any point in time. In addition, the outpouring of anger by Anons persuaded him to help the girl out, rather than turn a blind eye. And thus, a very touching story unfolds out of all the madness. But my job is to record people's recollections as they are presented, not to clean them up for public entertainment. You should take this for what it is. He saw a little girl at his unrewarding, not-so-difficult job, but felt it would be too risky to try and help her out in her painful situation, so instead he decided to come home and vent about it to other anonymous internet users. Anyways, my question. Should I stick it in her pooper? Among other things? She isn't going to be able to resist, and I can go in there when she's asleep, then cover up her good eye and mouth before she even knows I'm there. What, with all the drugs she's on, she's so messed up mentally that she probably wouldn't even tell anyone, considering she's barely talked to all the shrinks they've had her seeing since the accident. I'm a pretty gentle guy, and there's plenty of lube around here, obviously, and it'd be pretty easy to clean her up afterwards too. What do you think, B? I don't think you even have a job. Enjoy your cripple porn. Come on, guys, I need your help here. You are the cancer that is killing B. If this was even 7 months ago before the summer, you would have either been banned or spammed half to death with Guro. No one who matters gives a shit about your Bosnian bullshit, and B is about the funny, not the drama. Please, just leave the site now. Leave and never return. What are you talking about? This shit is actually pretty funny. B was never funny. It was, put your head in your hands and ask God, why? I fucking lolled at the should I stick it in the pooper question right out of left field. Well, now that he's asking for a serious reply, it's failing, but it's pretty good copy pasta by itself. This is one of the few situations that I have to say no to. 1, she's 7. Ew. 2, she's an amputee. Ew. If 1 and 2 appeal to you, then you have no other valid reason why except that you might lose your job. It didn't include any moral choice since that's probably the least of your worries. Why can't you just get to know her, make her like you, cuddle with her, hug her, sleep in her bed with her, tell her you love her? Damn it. Now I'm wishing I had a half-Japanese amputee to cuddle with. Well, she's already had a bit of a reputation around here as a trouble patient, since she can become really aggressive when she gets frustrated. She isn't so popular with the rest of the staff, and since she's so young, there's a lot more reluctance to show any inappropriate affection towards her than, say, to some 90-year-old that thinks Hitler's invading Paris every time she wakes up. The main problem is that she's asleep most of the time I have her alone. What should I do? Bullshit. A good story, but no one ever sends an orphan to a nursing home, and if she has to go, they use fucking bedpans. Yeah. They keep orphans with extreme medical and physical care needs in all the orphanages. The ones on every street corner, the ones with qualified nurses and doctors to manage their constant care, and they totally just toss the one-armed girl a bedpan and cut the cord on the call button. Don't try and tell me how the system works, asshole. I'm part of the system, and it doesn't fucking work at all. Pictures are required before further consultation. Well, I haven't taken any pictures yet. Official policy is no photography by the staff for legal reasons. Someone got busted in 2001 for taking pictures of the funny things senile old people do and posting them on the net. And I don't go back to work for another 10 hours, so I have no pictures of her to give you. Take pictures tomorrow and post them exactly 24 hours from the time of this comment. Deal? I'll try, but they do random searches on our bags since a new policy was enacted in June, in reaction to another nurse that was stealing narcotics. Thus, the main reason I've been hesitant up until now. OP, what the fuck is wrong with you? Joking about rape is fine, but actually planning it isn't so funny. I mean, not only has she gone through a lot of trauma, but now you just want to put her through more. And if you gain a relationship with her just to do this, she's going to have major trust issues for the rest of her life. Here's my advice to you. Kill yourself. It would do the world some good. I have to agree with this anonymous if OP is real. My second opinion is that you should fall in love with her and make her life a living paradise. The most serious post this anonymous has ever made on B. If you really cared about this little girl's future, you would not rape her. You realize that would fuck her up already fucked up life even more. You'd just be hurting her. Don't nurses have to take the Hippocratic Oath, too? I think your only real problem here is the objectification of the girl. I mean, I don't have anything against you wanting to fuck her, that's fine. Rape is bad, though, and having sex with a 7-year-old permanently damages them, so don't actually go through with it. If I had a bone to pick with you, as far as morals go, it would be that you need to stop treating her like an object and treat her like a person. Buy her some toys, and make the quality of her life better. Wait a few years, and after a real relationship has formed, and she's past puberty, then consider sticking it in her pooper. Until then, masturbate. Lots. I think buying toys to someone who spends their days as a cripple in a bed is more of an insult. Also, speaking of permanent damage, she seems pretty wrecked already, so relative to a normal 7-year-old, the percentual fuck-up factor could in no way be as great, even if he raped her in a fully conscious state. The internet is for lulz and rape jokes, but not planning it IRL. I'd post that picture of the fag from IGN who said, "Rape is just surprise sex, lol," in the barber shop, shortly before discovering his barber's daughter had been raped. Online ideas and conversations do not transfer well to IRL. Just to let you know, Anonymous will turn on you harder than you will have ever imagined if you're being truthful. We'll hunt you down. Make fun of this if you want, but you won't be safe. Well, fine. If you want honesty, I was kind of hoping more people would tell me not to do it. I mean, I'm posting in B. But seriously, I feel bad for her too. Of course, I also feel penis engorged for her, because my words cannot convey just how cute and soft and warm she is. Anon has feelings too. We understand. Don't rape her, befriend her. There's a difference between wanting to fuck someone until they're blind and what you're describing. You don't want to rape her at all, do you? You're feeling something entirely different, aren't you? I suggest finding out what she likes to read, then reading it aloud for her. Gain her trust and adoration, since, you know, inside you would rather perform a barrel roll than raping a 7-year-old amputee who had just lost her parents. You know what to do. Adopt her? I think it is pretty obvious that God wants you to adopt her and to be a good father for her, so you must fight your sinfulness every day again and again. Yeah, he's into some crazy shit. God. Adoption? Not a bad idea, actually. Seconded. If you're connecting with her, it might do both of you some good to take her in, if you can. And if you still feel the need to fuck her, then it can legally be incest as well. Bonus points. For all those people telling me to adopt her, I'd love to. She seems like she was a really great kid. Bright, outgoing, and cheerful before the accident. The problem is that people involved in the care of kids in the system often find it way harder to adopt them than someone with a less sterling record from outside the system. It's fucked up, but that's the way it is. You couldn't strike a deal with some good friend or relative of yours then? They adopt and you take care of her? Well, the problem is, if I'm nice to her and treat her kindly, more as a friend or father figure, she'd be likely, as a positive effect, to report it to the facility's psychiatrist during one of their sessions, in all innocence, who might then feel obligated to report that to the administrator, who would then probably fire me for showing inappropriate affection. Woo, family services, catch-22ism. What, does the staff just often rape the shit out of the patients? What kind of affection are you allowed to show? This seems pretty stupid to me. I mean, obviously, she needs some kind of friend. I'm sure your supervisor and her psychiatrist would agree. She sounds like a smart girl, so talk to her as an adult and treat her well. If she knows that you're risking your job to take care of her, she should be smart enough to avoid the topic with the psychiatrist. I mean, if she does start to like you, she'd want you to stay around, right? I've considered that too. I mean, she's actually really smart. She was in a school for the gifted before the accident, and her mother was a child psychologist, so they gave her a lot more freedom and choice than the average kid would get. And she was pretty gifted athletically too, which just makes the whole thing all the more tragic. Of course, she's also pretty broken now. Extremely withdrawn. Rare, she says 3 words the whole day, at the same time. She lashes out at anyone that tries to get too close. She actually bit a psych intern who was trying some play therapy with her in the hospital hard enough to draw blood before she was transferred here. The real problem is, if I were to try and form a bond with her, honestly, I'm afraid she'd do something to get me in trouble just to try and make me leave her alone, even if she really wants some affection. This would be a lot easier if she was just less traumatized. My personal suggestion? Music and books. There are plenty of devices that can help someone with one arm keep a book steady and open, etc. Listening to and appreciating different types of music is always an option, and she can still write. If she's as smart as she said, She might be able to vent eventually through writing or drawing. Just give her stimulating, fun, but not patronizing things she can do in this condition. She might never open up to you, but that's okay. You're just trying to help, and it sounds like the rest of the staff really haven't bothered with this kind of thing. By the way, this scenario involves no harm whatsoever. Best case scenario, she realizes that her life's not over, and she has people around that are genuinely trying to make her happy. B demands a pic by this time tomorrow. You know, the main reason I would have not to post pictures is that she's a pretty distinctive girl. I mean, how many half-Japanese, blonde, green-eyed, singular, one-armed, no-legged 7-year-olds are there? That idiot I mentioned before got busted just for posting random old people, and there are millions of those. Just curious, but does she have stumps? Any possibility of her getting at least prosthetic legs? Actually, she gets bused to a rehab facility at the hospital almost every day, where she's learning to use prosthetic legs and an arm. It's like it's the one thing she actually cares about anymore. I hear the staff there are amazed at the progress she's making. It makes sense though, because she really hates her wheelchair. The first time I answered one of her calls at night, I'd wheeled it out to put her in it, since that's the standard procedure, but she asked me not to use it, so I carried her instead. I guess that's the first time I thought about her in an illegal manner. Really. Anyways, she wears the prosthetic arm during the day, but I'm not around then, so I've never actually seen her using it. I have seen it in her room, though. It's a nice model. Probably the best in the whole facility. I guess her parents had a pretty responsible life insurance policy, so she doesn't have to deal with substandard prosthetics. At least. Has a nice prosthetic eye, too. It looks just like her real one. As much as a fake one can, anyway. Of course, the scarring over her eye kind of helps to give it away. Lolly hate rape. Lonely, orphaned Lolly love caring man. Years later, good sex for you. I know. I mean, I'd prefer not to rape too. It's a really complex situation, and this is B. I figured I'd stick it in her pooper out of the way, just to get responses going. Well, I guess I have to try, at least. I'll bring her something Christmassy tonight. She's been getting especially depressed since the facility started putting up decorations a week ago. Poor kid. Good way to see how receptive she is to interacting with me outside emergencies too. Not sure what'd be appropriate or disposable enough though. I know you're hardly the people to ask about appropriate anything, but any ideas, B? It's too late for a Christmas advent calendar. Love those stupid things. Maybe a Christmas orange chocolate? The ones you get to whack really hard? If candy is against the rules, even better. Just go shh and tell her not to let the other staff know she has it. Can a half-Japanese chick even have blonde hair and green eyes? Sure they can. I mean, I've seen one myself. You know, in her room. Apparently, her father was almost stereotypically Scandinavian. Bright blonde hair, blue eyes, 6 foot, etc. She's still got pretty clearly Japanese features. Mostly. Luckily, of the cute kind. But most of her coloration is equally pretty clearly from his side of the family. Her skin is somewhere in between a pale Japanese and a pale, rather goldish. Frankly, I'd say she won the genetic lottery. Too bad about the non-predetermined alterations. So, OP, have you already determined your course of action? Okay, OP here. I won't be poopering her in the foreseeable future. I mean, when B can come down at least in the slight minority against doing a barrel roll into a lolly, it clearly isn't the right choice of action. Though, I guess I did know that already. I really wish I could get you guys a recording of her voice. She doesn't have an accent because she was born and raised here in America, and her mother, the Japanese half, come from a long line of Japanese Americans who disowned her, I guess, when she married Mr. Swedish Meatball, because Lolly's relatives and contact information is non-existent, just social workers. But her voice, well, it's just the most beautiful thing I'd ever heard. When she first spoke to me about the wheelchair, even as flat and brusque as it was like hearing an angel whisper hymns, and I still get goosebumps every time I've heard it since. I can't wait for tonight. I think I should bring her something else, maybe a tiny little keychain-sized stuffed doll or something, or maybe a little wristband. Any other ideas, guys? A little stuffed doll could be a nice little gift. Although, if you could get away with it with the administration, give her a normal-sized teddy bear or something. If she blushes in an innocent way from simple human touch after her parents have been killed and her body mangled, then either she has the willpower of 10 men, or her priorities are somewhat screwy. She's also biting orderlies and speaking less than 3 words a day, and it was the fact that he had to hold her in the bathroom so she could take a fucking piss, not a simple touch. You make a good point though, Anon. I have to admit, she didn't seem to get at all distressed until she may have possibly noticed me looking down there, which I quickly stopped doing just before I caught her looking away as well, out of my peripheral vision. I was being pretty unprofessional, it's true, since I'd never had any inclination to look at any other of my patients taking a piss before. But then, half of my patients before were in Depends, and the other half, well, I prayed for their merciful deaths every time. She's not a robot. She's not a perfect, cold-hearted Ray clone. She's a real girl. Here's a tip. Don't give her pizza, 'cause Lolly hate pizza. I'll bring it up at next week's meeting. Perhaps a possibility of allowing individual gifts, with the potential that it could improve morale with the rest of the patients to grandparent her a bit. Well, the non-racists, anyways. This is just for tonight. Baby steps. You do know how epic it would be if you were to post a picture of her here, right? It would instantly become a 4chan legend. Anonymous declares this as a fact. Look, I tried to post a longer version, but it disappeared, so I'll sum it up for all of you. Someone in a professional, caretaking role for a child, taking a picture of that child, clothed or not, then posting it on the internet is a bad idea. This is not even taking into account her particular uniqueness, since by the time that picture had made its way around the internet, finally winding up on some disabled children's charity or advocacy group, someone will have wondered who she is and where it came from. And being as unique as she is, they will find her. Then they will wonder who took the picture. They will find me. And at that point, clothed or not, innocent or not, I will be fucked in ways too numerous to mention for the rest of my life, whether I am ever charged or convicted of anything. Think about it, people. And after this process repeated itself a few times, if the first or subsequent attempts ever happened at all, she'd wind up in institutional care again, permanently, probably before she even turned 10 years old. And once she's there until she's 18. At least, another 8 years of no love, no affection, minimal contact, surrounded by senile and angry, sad old people and distant caretakers. Maybe she'll get sent to a school for special needs children, assuming they find one that'll take her with her ever-increasing behavioral problems. And they will increase. The more she's emotionally neglected, it's a guarantee with the sort of problem she has. Even if she masters her legs and arm, even if she can use the bathroom by herself, her life will be an ongoing empty pain that will only grow with every year. Odds are good that she'd find a way to kill herself, with her intelligence and impressive willpower, before she's even 15. So, what's your solution? Magically turn back time to make the accident not have happened? Magically heal her mind so that her body's imperfections alone are less likely to destroy her future? Maybe you could magically heal both of them, and she'd probably be adopted right away. There is no magic. The world doesn't work like that. She has no future. Not a future she deserves, anyways. The fact of the matter is that I'm probably her best chance for a future worth living, one way or another. You may not want to admit it, but it's the truth. Go fuck the holes you cut in your son's dolls and cry yourself to sleep over the injustices of the world if you aren't strong enough to face them. I need to get ready for dinner, then hit the mall before heading into work. Need to pick up that stuff for her that I'd mentioned. Wish me luck, guys. And thanks for the productive advice I was given. Food for thought. The rest of you can go fuck yourselves.